Hello, I'm Dr. Bang Ki-sung, the hair wizard here to protect your hair. It's great to see you. First off, what we commonly refer to as a hair loss medication is essentially a drug designed to inhibit the production of a particular hormone among male hormones. In other words, it's not actually a hair growth stimulant. Taking this medication won't suddenly make your hair grow thick and luxuriant. I'd like to explain it as a medication that seeks to slow down the process of hair loss rather than prevent it entirely. Now, pharmaceutical companies have researched and developed these drugs. Broadly speaking, by brand name, there's a medication that starts with PRO and another that starts with AVO. These two drugs are considered original formulations. An original drug means it was researched by a pharmaceutical company, granted approval, and then initially produced. In essence, you could even say it's in its most optimal form. Anyway, by active ingredient name, the drug called Propecia has the ingredient finasteride, and the one called Avodart has the ingredient dutasteride. So moving forward, I'll refer to them simply as Fina and Duta in my explanations. Fina and Duta function through distinct mechanisms. Simply put, Fina has been around longer than Duta, and it's a medication that, while not exactly weaker, blocks a little less of the hormone. To put it simply, this is the mindset of people who choose the Fina family of drugs. They don't want to experience side effects but still want to see drug efficacy, so when they feel anxious, they tend to choose Fina first. Conversely, those who choose the Duta family have accepted their hair loss and wish to achieve clear results, stabilizing their condition. They are more likely to opt for it. Honestly, I used to prescribe Fina-type drugs a lot, but lately I've been using Duta-type drugs more often. The reason is that I've observed patients who continue to lose hair even while taking Fina-type medication. I mean, in my actual clinical practice, and that was really frustrating for me. When hair loss persists despite medication, we are faced with either performing an additional hair transplant or continuing ongoing treatment, leading to immense disappointment for patients. But after trying the Duta family, I found it certainly provides a more effective defense than the Fina family. This aspect can never be completely objective. It's purely my subjective opinion, informed by what I actually tell patients based on my clinical practice. Therefore, when patients come for a consultation and I observe their hair loss progressing, I typically recommend dutasteride-based medications first. I then tell the patient to consider it, research it themselves, or they might feel some reluctance. Because no matter what I say as a doctor, if the patient looks it up and says, "Oh, this scares me, I don't want it," they won't take it. So I say, "This is the medication I'd like to prescribe, why don't you look into it and see if you're comfortable taking it?" So I give my patients time to do their own research. They go, research it, think it over, and then later they'll come back and say, "Okay, doctor, I'll take this specific medication." At that point I explain, it's generally best to take it consistently for about a year, and then I write the prescription. Both Fina and Duta are effective medications. However, in my clinical practice, I lean towards using Duta more. This is primarily because, from my clinical experience, it provides more certain results. The drug's mechanism of action is quite complex, so it would be good to explain that in more detail later. There's actually a lot to say about these medications. So for today, let's just clarify that there are two distinct types of hair loss medication, finasteride and dutasteride. Both are quite effective, but if you conduct some research and educate yourself before coming to the clinic, your doctor will certainly elaborate further. At that point, if you were to ask, "I'm interested in taking this medication, what are your thoughts on it?" it would lead to a more in-depth consultation and a more informed decision. Today we've very briefly looked at hair loss medications, specifically finasteride, dutasteride, Propecia, and Avodart. Next time I'll take the opportunity to explain them in much greater detail. Thank you for watching.